So it's local public health, the MHOs and the health authorities, and it depends on the scenario. So we have very set guidance for declaring outbreaks in some settings, like healthcare settings, like long-term care homes, schools, for example. But in other settings, it really depends on whether there's a risk to the public. So if we are able to find everybody who was at an event, a party, for example, we have everybody's contact information, we know that there's nobody else that we need to follow up, then we don't necessarily have to put out a public notice. So, for example, we've had public notices about restaurants, we've had public notices about a number of bars and nightclubs here in Vancouver. And the reason why we put out those public notices was because we could not be sure that we found everybody who was in that place during the exposure period. And one of the things that we've put in the order is that people have to take down a name and contact information. And that's for two things. One, so we can find people quickly, and that we can find everybody who was there. So we need to reinforce that. It's in our best interest to give the restaurant our name and phone number so that if there was somebody there who was sick and was put us at risk, then we can be contacted quickly and we know what to do so that we can protect those who are closest to us as well. So there's a variety of things that we look into it. It depends a little bit about where the setting is that it's happened, how many people have been exposed, what type of exposure it is, and whether we are able to effectively find people who may have been at risk. Some of these are come from the restaurants themselves or the exposure places themselves, and they do it out of a way to be proactive with their public. And it may not have been on the advice of public health. Public health will make those decisions if we will make those announcements if we need to, but those businesses can put out their own announcements if they want to. So it's essential if we direct them to do it, but they're able to do it as a way of just reassuring their customers and the people that work in the facility that the right measures have been taken. So there's a bit of a balance there, but in terms of who orders people to make sure there's a public exposure, that would be public health.